And 3 generations of the same family from ages 27 to 78 are all going under the knife. And they're telling the ladies why they're all getting plastic surgery at the same time. All that and more, next on The View.
Grace DeMore, her 2 daughters, Rita Whelan and Joanne Termini, and Joanne's 2 daughters, Erica and Danielle. They are taking family togetherness to the extreme because they're all getting cosmetic surgery in the same week. And the man who is going to do it all for them is Boston plastic surgeon Sheldon J. Sevinor. Welcome to all of you. Thanks for joining us. Dr. Sevinor, we talked about you not so long ago on the show because you took an older woman. How old was she? 80 years old?
80 years old.
And you gave her, I think, a facelift and something with the breasts as well?
Eyelids, chemical peel, facelift. Chemical peel.
And that's her.
Look at her boobs.
Pretty.
Yes. Look at that woman. She's 80 years old.
Yeah, breast implants as well.
Yes, we did it for Good Morning America.
Exactly.
Yeah.
So that's fairly controversial, but I would think that this would be very rare, that a whole family comes into you and says, hey, we'd like to have surgery?
It actually isn't. Over the last 27 years, I've seen an increased trend in my practice in both Boston and Miami of patients, couples, husbands and wives that come in for cosmetic surgery together. And from that, the newest trend is actually families that want to have cosmetic surgery together. What usually happens is one family member, in this case it was Rita, decides to have cosmetic surgery, has a very good experience, a positive experience, and it gives the other family members the encouragement to do something that's bothered them for years.
Well, Joanne, why don't you explain how this all happened, that the family would decide to, we're going to go do this as a group?
Yeah.
Well, we're close, and we support one another, and I have a lot of faith and confidence in Dr. Sevinor. He did an aunt of mine about 25 years ago. She had a facelift. And then he did 2 procedures on Rita and 1 on my mom.
And your mom, so you figured why not?
And my daughter, and my youngest daughter had a breast reduction, and she was very pleased.
Do you get, like, family discounts for this, or is there... Okay, well, let's talk a little bit about what's going to happen to each one of you. We're going to meet the rest of the family and discuss the surgeries. And we're going to start with the matriarch, Grace DeMore. Grace, you're 78 years old. Correct. You've already had some work done by the doctor, and are you at all nervous to go under the knife again?
No, I'm not.
Okay.
I'm really excited. I'm really excited about the whole thing, and it's time for me to do it.
Well, what did she have done before, doctor?
Before,
what's going to happen now?
Grace didn't like the loose skin and fat on her arms, so what I did was called an arm lift. And I did that about 2 years ago, and you can see the before and after picture. And now what I'm going to do on Grace is a facelift, a neck lift, and I'm going to be doing a chemical peel for her eyes and around her forehead and around her mouth, and I'm going to make her lips improved with Restylane, a great new product that's out there. And I want to get rid of the jowls, the loose skin in the neck, the wrinkles around the mouth, and especially
Grace,
around the forehead.
Grace, you're going to look younger than your daughters. Isn't 78 years old? Isn't that a little risky?
Well,
I mean, we heard about Olivia Goldsmith, you know, with that
exactly.
And then just there was
you know,
somebody else
this all relates to what I call down aging. We're reinterpreting in today's society what it means to get older. Older is better. We're changing the hallmarks of aging. When you're 40, it's more like 30. When you're 50, it's more like 40. When you're 65, you're considered young today. It's like the second half of your life. And the most important thing is the patient be healthy. I'm from the old school. I believe the safest place is a hospital. Yeah. And I handpick my anesthesiologist. I want someone who I would want to give me anesthesia and give my family anesthesia. And I do an extensive medical workup.
Before you do anything.
Before I do anything.
Yeah. Okay, let's move on to Grace's 2 daughters, Rita and Joanne. Rita, you're 58 years old, and you've had some work done already. You had a chemical peel, right? And what else?
I've had a chemical peel.
And the liposuction?
Liposuction. Look at me. I went from a size 12 to a 6.
Without diet? Wow. No diet.
When was that? How far back was that?
That was, I think, was that 4 years ago?
I did that about 4 years ago, and I want to say that liposuction is not a quick fix.
So what do you need to do to her now?
What are you doing? She's perfect.
What I'm going to do is Rita doesn't like the loose skin of the jowls in the neck area. And what I'm going to do is a facelift and a neck lift, and I'm going to give her enhanced lips with Restylane, a new product that's out on the market now. Yeah. And just give her the ability at her age to look the best that we can.
There's no threat of addiction to this particular... I mean, she's going You know, you never know what they're going to do next.
Well, the thing is
Toes, toe fixtures, everything.
Yeah,
People
they
are
do
crazy.
toes
you know what?
now.
Yeah.
There's a great deal of psychology in plastic surgery. A patient must realize we deal with improvement, not
Yeah.
perfection. And if a patient's realistic as to expectations, they're a good candidate.
Yeah.
But you just don't operate on everyone that comes in your office. You've got to be very selective. These women are realistic.
Well,
Right.
Joanne, you're a virgin to all of this. This will be your first time. What do you want to have to this? Being a virgin.
Yes, I
What
am.
are you going to have done and
I'm
why?
having, for years. My stomach. I've had this problem.
Sit up.
Oh, come on.
What about
Honestly, I've done it.
No.
It just doesn't
We
work.
used to tell her as a young girl that, oh, it's going to go away. It's only baby fat.
Yeah.
So this is Joanne. This is actually
This
Joanne.
is Joanne. This is a
I'm
front
ready.
view of Joanne's stomach. And you got to remember that I said this isn't a quick fix. I wouldn't do this on Joanne until she made a commitment to me after I did the liposuction for her abdomen and her hips that's coming up, that she make a very strong commitment to me that she's going to diet and exercise. And to me, that's key.
Well, why can't you just do that to begin with? I mean, why
Because
is that?
there's so many people. This is hereditary. Look at Rita. She was a size 12, went to 6. These 3 women are having the same procedures done that Rita basically had. There are certain areas, no matter how much you diet and exercise, that are resistant to losing the weight.
Okay. Now we have Joanne's 2 daughters, Erica and Danielle. Erica is 29 years old, scheduled to have 2 major procedures done. What are those?
Well, when Erica came to me, she was bothered after pregnancy with the droopiness and the sagginess of her breast, and then her nipple was pointing downward. So we're doing a mastopexy, which is a breast uplift, and she wants more contour to her breast. And also, in addition to that, we're going to be doing liposuction of her abdomen and her hips.
Now, is that necessary? I'm looking at her body.
She's a young girl. Does this have anything to do with the Sports Illustrated magazine? I mean, does it? Sweetie, come on, tell me.
You brought it up.
But I mean, you're only 29. So what if your nipples are hanging? Who cares? You're married, you got the baby. Really, so what?
They're pointing downward.
I know the problem. But, you know, I mean...
We're all headed to Venezuela.
Yeah, we're all headed south. But I mean, does your husband really care if you have perky
Well,
boobs?
see, I don't have a husband.
All right. And finally, 27-year-old Danielle is also having liposuction of the abdomen again, right, and the hips. Now, you have not had children yet. Is there any risk to her in having this procedure?
No, liposuction is removing, debulking fat. It isn't like a tummy tuck where we're removing skin, and I would suggest waiting till you've had your children for a tummy tuck, but not liposuction.
But this girl, Danielle, you're only 27 years old, and looking at those pictures, you can diet and exercise with that issue.
I do cardio kickboxing. I walk like 3 miles a day.
Yeah. Are you cutting back on calories? Are you doing that?
I try, yeah,
Well, that's number
definitely.
3.
I mean, I eat
But
good.
there's nothing
I don't
abnormal about your body. That's what I'm...
hereditary, and I think sometimes
Right.
if you work, as hard as you work out, there's certain areas you're just not going to lose.
Yeah, but this is crazy for you, I think. It's one thing for your mother here, but I mean for you,
But I
because
don't
I
want
saw
to wait
those pictures.
I don't
We
want
want
to
to
wait.
look good now.
Yeah.
I love my mother, but I don't want to wait till, I'm 50.
Yeah, all right.
And what you have to remember is that it's a different degree of liposuction in these 2 young women compared to their mom. You know, we're just doing some liposculpture, which is minimal in the younger women, and Joanne is having major liposuction.
Yeah.
There's a big difference.
When do you plan to do this? I mean,
We're doing it in March. I'm going to do the surgery over 4 consecutive days, and they should be ready probably after about 12 weeks to see the results.
so when could we have them back then, in theory? June?
12 weeks after the surgery.
12 weeks after the
Yeah.
surgery. Okay,
Nobody's scared of the anesthesia. You're not scared. I'm scared. I'm projecting my own fear of this whole thing, to tell you the truth. To me, it's
And
frightening.
you want to know something?
Yeah.
Plastic surgery isn't for everybody. It's not the answer to all of life's problems. It's not a panacea. But for someone highly motivated, realistic as to expectations, at least you can learn about the
Have you ever
process.
had it done on
No,
yourself?
but when I need it, I will.
Based on the reason they're getting it, I mean, how much final price tag for these ladies?
I made it affordable for them, and generally it ranges. These procedures can range throughout the country from $5,000 to $30,000.
Oh my gosh, okay. I'll keep mine heading south. Our thanks to Dr. Sevinor and to Grace, Rita, Joanne. I like it south. It's warm. Erica and Danielle. We'll be right back. Well, Joy, you can relax because from grandma to granddaughters, the family who made plastic surgery a family affair are all A-OK.